Thank you, Mr Speaker. My question is again to the Minister for Health. Minister, did Public Health tell you the doubling of reported cases within 48 hours after masks were removed had nothing to do with lifting those protections?
Honourable Minister for Health.
Here. Well, thank you, Mr Speaker. Thank you, Ms O'Connor. Ms O'Connor, I understand your advocacy around masks, despite the reduction of restrictions and mask mandates, of course. Tasmanians can be encouraged to wear masks freely if they see fit. Mr Speaker, I often wear masks in settings that no longer have the mandates, Mr Speaker. I think what's important here, Mr Speaker, is to recognise how well Tasmania has done when it comes to the pandemic, Mr Speaker.
Point of order, 45 relevance. We're not here, Mr Speaker, to hear how well Tasmania has done. There's 75,000 infected Tasmanians so far.
I've heard the point of order.
Question.
I've heard the point of order.
One question.
Yes, and the fact that you make a short question doesn't mean that the answer necessarily has to be short. The Minister is allowed to answer it in the best way that he sees fit. And as I've mentioned the day before yesterday, the issue is, provided that the Minister is maintaining the policy direction of the question, then he is relevant. So I'd ask the Minister to stay relevant to the question, but answer it as he sees fit.
Thank you. I believe the subject of masks is relevant to the fact that I'm answering the question. Other states moved ahead of when it comes to reducing the restrictions or easing the restrictions when it comes to masks, Ms O'Connor. Other states were ahead of us.
That's not what I asked.
In that sense. And, on March the 11th, we announced in line with the public health direction once again that masks are no longer required in most indoor settings and workplaces. This means no longer required in retail settings at most workplaces, hospitality venues and events, of course. Now, masks are cheap and affordable and accessible method to help minimise the transmission of COVID-19 in the community, and are still strongly recommended if you cannot physically distance, if you are in work or in a public-facing role, or are vulnerable or will be near someone vulnerable to COVID-19. No,
Ms O'Connor,
people not to wear masks.
Ms O'Connor, I've warned you a number of times today. Please, you've asked the question, allow the Minister to answer it. Another interjection and you won't be here for the rest of question time.
Ms O'Connor, no one is forcing people to take their masks off.
That's right. That's right.
In many cases, they're recommended, of course, if you are in and around vulnerable settings, cannot physically distance, or close to vulnerable people who are vulnerable to COVID-19. So, Mr Speaker, I do want to highlight the fact, though, that Tasmania has one of the lowest rate per capita of COVID hospitalisations and currently has the lowest rate of ICU admissions compared to other states and territory. In fact, as March the 23rd, of the 28 people in hospital, only 9 are being treated specifically for COVID, and there are currently no patients in ICU for COVID. I do want to commend the people that have worked so hard at the COVID at Home program as well, Mr Speaker, and I'm mindful of time, of course. And of course, the COVID at Home program and our high vaccination rates are significant contributors to Tasmania having one of the lowest rate or hospitalisation admissions. And as of the 15th of March, the COVID at Home program has supported over 6,000 people, COVID-positive cases, to safely recover at home since its inception. And today, COVID at Home has hit a new record of virtually providing care and monitoring to 1,037 patients in their home, I'm advised. So that's an incredible achievement. It's worked very well within our preparedness and, of course, eased that pressure on our hospitals, which I know was the focus of not only our policymakers, our public health team, our health commander, but of course our entire government as well, Mr Speaker. So I want to commend all those people across government and the community have worked so hard with respect to our COVID-19 or our pandemic response, Mr Speaker. The people that work within our call centres as well have taken an extraordinary large amount of calls, Mr Speaker, supporting people who quite rightly would be at an anxious time in their lives when it comes to testing positive or concerned about testing positive respect to COVID-19. I thank Ms O'Connor for the question, but I want to reiterate the very close association, of course, with the Premier and public health in terms of the measures that we've put in place, and reinforce the fact that while we are easing mask restrictions, and one of the last states to do so, no one is forcing people not to wear masks.
That's right.
Particularly when it comes to people that are unable to physically distance, or you are in and around people who are vulnerable to COVID-19.